We all want your child to be healthy, prosperous, and do all the things they want to do in life, right? That's why we get into pediatrics, is to help kids grow up. And we're all on the same team with parents. Yeah, I think ultimately my concern with these changing recommendations is that it's going to cause worsening health outcomes overall for our patients and for our kids, all throughout our community, both nationally and in the Grand Rapids area. We've had decades of information through the American Academy of Pediatrics, or AAP, that have shown vaccines to be safe at preventing illness, safe at keeping kids out of the hospital, and ultimately safe at keeping kids alive for longer. Um, and so when we add more confusion to these recommendations by creating different classifications that are somewhat arbitrary and not based in objective science that the American Academy of Pediatrics has set forth, my fear is that it's going to cause more parents to be more skeptical about vaccines, more hesitant, and miss the appropriate windows where we need to get the kids vaccinated to give them that lifelong protection. So my current recommendation is still to follow the AAP, or American Academy of Pediatrics. That's the same recommendation that the Michigan Department of Health and Human Services has provided, which is universal vaccination. So continuing to follow the recommendations to provide those vaccines per the schedule that was set forth prior to these changes with the CDC. So that would include vaccinations against hepatitis, influenza, RSV, rotavirus, and the meningococcal vaccine that the CDC is no longer recommending for all kids.